Hello and welcome to the Train Right podcast. Today's guest, we have Emily Carr. Emily is a doctor of physical therapy who graduated with both her undergraduate and doctoral degrees from the University of Michigan. Shortly after graduating, she moved to Colorado and currently resides and works in the Boulder Valley. She comes from a background as a competitive soccer player, which has influenced her treatment style and approach to the high-level athletic population, which comprises most of her caseload these days. She is fortunate enough to be treating at Revo Physical Therapy in Boulder, Colorado. Big surprise, that's how I met her. And she specializes in the treatment of endurance athletes. She's an avid hobbyist who will do pretty much anything if it's outdoors. That's mountain biking, skiing, soccer, and running, to name a few. When she is not at the clinic, you can find her searching and hoping for the perfect powder day, exploring new mountain biking trails throughout Colorado, and hanging out with her exceptionally lazy rescue pup. Hi, Emily. Thanks for being here.
Thank you so much. I'm really excited. This is my first podcast, so I feel very honored to be hanging out with you.
Yes, I'm so excited. So we're sitting in Revo.
Yes.
So Revo Physiotherapy. I just call it Revo. So
It's all good.
I mean, anyone who follows me on Instagram knows that I come here a lot.
No, I feel like you're like the most tagged person, and it's mutual between Revo and here.
Okay,
so
I hope so. So this has become. I mean, I found these guys through Matt Smith was my original PT.
Yeah.
I found him through my huge accident recovery.
Yeah.
And so, I mean, I've dabbled in physiotherapy. Like I've seen the need for it kind of throughout my running career.
Yeah.
But it wasn't until, but it was kind of like a typical runner. Like I would get injured and then I would be like, okay, well, I guess I should go to PT now. Like I literally can't run.
Kind of wait for things to happen. Exactly. And then,
yeah, like literally I remember the last time that I went to a PT before the huge accident I had was, this nagging like nerve pain that was caused by some like impingement in my hip.
Yep.
I always say to, all the runners that I coach that pretty much almost every single running injury comes from hips or core imbalances.
Yeah.
With the exception of me, if you fall off a cliff.
There's a little asterisk there.
There's a little asterisk, and it's definitely applicable to, blunt force trauma. And so, these guys just changed my life. They've become my extended family. When I was recovering from all those injuries, it was like a full-time job.
Absolutely.
And I was here like twice a day. And, they leading technology and like blood flow restriction, when I couldn't wait there, they're just amazing. So that started my kind of love affair with PT.
Yeah.
And I've, been an avid believer in not like believer because it's a cult, but a believer in the process. And I come now it's just part of my routine.
Yeah, absolutely. No, I feel super fortunate to be here, and the guys I've learned so much from them.
Yeah.
And I feel really lucky to be able to continue to learn from them and kind of advance my career in that way.
Yeah. And then there's a huge, what's the word I'm looking for? Just mix of athletes that come in to Revo. It's not just runners. There's a lot of cyclists.
Lots of cyclists. Yeah. Lots of endurance athletes in general, but it's like a whole spectrum. So I can see I've seen pediatric patients here. I've seen geriatric patients here, and I really love that. And I think that's something I really love about treating in Boulder is everybody has the same goal. They just want to be able to continue to be active. And that looks different for everybody. But it's that spectrum of just like what is active to them and how can we keep them continuing to do that. Yeah.
And so I guess this is my selfish ploy for not only the athletes that I coach, but I think just the running population in general, or endurance athlete population in general, stressing the importance of physical therapy.
Yeah.
And so I guess I don't even want to specify it for runners yet, but why do you think that strength training or, physio is important? And I guess I can kind of use those. But there's a difference. There's a subtle difference between physical therapy or, strength training.
Yeah, absolutely. I think for endurance athletes specifically, their sport is not enough alone to meet the demands of their sports. So you can't just run and expect running to be enough to drive the adaptations that you need to continue to be able to run however many miles you want per week at the level that you want to run. So I feel like it's been a really slow realization in the running community that strength is a really pivotal piece to that component, and that's where PT can come in to really tailor that. So at Revo, we work a ton with strength coaches as well, but I think PT is kind of the piece where we really dive into like the biomechanics and like maybe little subtleties or nuances with form and things like that. Let's say like for a totally asymptomatic runner, we can pick up on little things that could potentially kind of lead to injury down the road and really hone in on those. Develop those out with a kind of a strength program and go from there. And then like obviously with the symptomatic runner, that's our bread and butter. So I would love to see more asymptomatic runners, so people coming in just from like a prevention standpoint. But a lot of times it's people are having issues, kind of chronic type things that have crept up on them. And that's where I think we can make a huge difference. So
yeah, so I mean, I was honestly, when I first came, like I was afraid, especially because now, like the more I read and the more, especially for the trail running that I do, Matt, my PT, like he has me. I mean, this I just say him because he's like, I don't know. I just always associate him, but like everyone here at Revo, like he prescribes me to do heavy lifting.
Yeah,
and I'm just like, oh my god. First of all, my comment is like, whenever he does these things, is like it's like full body lifts. It's not just legs. It's like I was like my bird runner arms, like I can't lift this, and he's like, but Hill, you got to do it.
I watch you roll your eyes at him every time when he's like, you need to do a trap bar deadlift. And you're like, ugh. But it's so important. So it's like going back to like running alone is not enough to make your skeleton stronger.
Yeah. And so like, let's talk about this, because I was afraid that like lifting heavy, I'd get like big.
Yeah.
And you know, like I'm past this idea of like, I think still some runners, and I have to be sensitive to this. Like some runners are afraid it's like, you know, like the VO2 max, like the easiest way to boost VO2 max is be super light.
Yeah.
But I think that applies less to trail runners.
I think so too. And I think there's still just this big misconception. I think it's shifting. I think every time I think of like a strength, someone that's adopted a strength training program and has done really well, I think of Emily Carr. She's a marathoner.
Yeah, I know her.
And she was a huge advocate for CrossFit. She did it for a short time and just saw these huge gains in her performance. And she's also a really awesome example too of like, you don't have to be the leanest person out there to perform really well.
Yeah.
But she was a really big advocate for that strength training piece, and I think she was the first person or one of the first people to like really put it out there, like maybe 5-ish years ago. So kind of building off of that, I think going back to running's not enough to give you the stimulus that you need to do really well. Runners have super strong legs, but hips and core are typically a lot weaker. We need to load the axial skeleton, meaning like the spine and the hips and pelvis, a lot more than we do in just running. So that's where that like external load with like a deadlift, squat, things like that really comes in. And I think that's why we have a program for you so much too.
Yeah. And also some things that like, which I appreciate. Like I'll just, I mean, it's a form of core. I do these on my own, but like push-ups.
Yeah.
Or, you know, like in rows.
Yeah.
And oh my gosh, like banded pull-ups, because like I need the band.
Okay, no shame, no shame.
But yeah, like, you know, every time I'm just like, oh my gosh, like, do I really need to be doing this as a runner? And I'm like, but I think it's awesome. And I've known a difference. I mean, certainly in my recovery, like I think I attribute it a lot to Revo.
Yeah.
Because if I wasn't, I mean, obviously I was super devoted. Like I mentioned, it was like a full-time job.
Yeah.
I was in at Revo like twice a day doing things. And a lot of it really wasn't that much. A lot of it was, you know, I couldn't walk for 3 months. So like I had to get creative, and, you know, so did Matt too, but there's plenty of stuff that we could do.
Totally.
And, of course I wasn't lifting heavy then, but then, you know, we progressed, and, I just noticed a shift that I felt like stronger, more stable. I was able to withstand more training load, like running. And at that time I found cycling too.
Yeah.
I don't know if you can talk to that point. This is kind of a curveball, but like, I mean, I've incorporated cycling, but I like how that benefits. It's different muscle groups to me for running.
Yeah, I think everyone's different with how they like to like cross train or like add in strength training.
Yeah.
I know people that purely just run, but they are really good and careful about their volume week to week. And that's a lot on the coaches.
Yeah.
but that's where I come in, and I really stress the importance of if you're going to be running these high volumes, you need to make like you need to incorporate that strength training to make sure that your skeleton can withstand all that impact.
Yeah.
And so that's where like the threshold for these runners too for strength training, a lot of them haven't strength trained before, but they're such high level athletes.
Yeah.
The threshold for seeing an improvement is a lot lower in terms of that strength training. So I say like 2 days a week, get in the gym, like let's give you just a couple things and you can see such a big difference.
Yeah.
I just think like if people can commit to that, the gains are so big there. And I think going back to like you were talking about a little bit about performance, when I'm having trouble pitching a patient, like a runner, like you need to strength train, I bring up the performance piece too. So not only is running or strength training a great tool for injury reduction or risk of injury, it's also great for performance. So there's tons of research on the improvements of strength correlating with running economy and things like that. So you brought up VO2 max. Your body becomes more efficient at consuming that oxygen the stronger you get. So there's a lot to be said there.
Oh yeah. And I mean, and also just I think if there's like some sort of an imbalance, like your body's pretty good at adapting.
Totally.
Like I definitely have, experienced that. Like, I mean, every person is different. I feel like my body still has its like, right side versus left side.
Totally,
One side's tighter,
than
the other, and it's continued to work on. But like your body's very smart. So if you can kind of like try to work in unison with it, I feel like you can get a lot out of it.
It's really great to work on those imbalances.
Yeah.
To bringing up like where PT can come in all of this. I talked a lot about strength, but also looking at like biomechanics. We can really hone in on side to side differences and those like subtle compensations that can really develop into other things. That's where we really come in, kind of identify those and then work on like the motor control, the muscle activation to kind of prevent or improve upon those. And prevent further injury. So that's kind of another big piece of the puzzle where we come in for endurance athletes.
Yeah, and I mean, I love that because I feel like I've seen that for cyclists a lot. It's like, it's something because for runners, it's so simple. Like we just have shoes.
Totally.
And so we can go out and run. But for a cyclist, they can come in because they have to get a bike fit.
Yep.
So they have to because I get a bike fit and I'm not like a pro cyclist, but I ride my bike quite a bit. And so with that repetitive motion, you can tell if something's a little bit off.
Totally.
And so it was so funny, like when I was able to run again, I remember coming in and Revo put these little sensors kind of on my ankle, my knee, my hip, I think the center of my chest. And then they had me do single leg squats and kind of like some double leg squats and measured how my hip drop. I also did this on the treadmill, so they were seeing kind of my trunk lean and where if my knees are falling in, which is indicative of like weak glute med or something like this. And man, I remember that the first time when I was doing this just at the very beginning of the strength work. My knees were collapsing in, and I'm a very strong runner. So I was like, oh, this couldn't happen to me. I've got strong legs. Come on, I'm not a waif of a runner. I'm I felt like I was pretty strong, but, it's just, running is pretty, brutal, to the body. And so it's these little things. And when I'm talking about hip drops, this is from the axes of, if you draw a straight line across your spine, when one foot hits the ground, you can see the other side either drop or go up, drop basically to compensate it. And that degree should not be more than 5%. And I remember one of mine, even if it's 5 or 6, I think one of mine was 9%. That can cause significant issues over time.
It's huge. If you think about how highly repetitive running is, if you have that torque going through the joint that's not meant to be going there, and especially talking about ultra runners, right? That's an incredible amount of force going through a joint. So let's just use the knee joint, for example, because that's where most people see the most dysfunction.
This is what I wanted to get into.
I always look upstream. It's typically it's not the knee joint, it's coming up from more proximally the hip and core. But that repetitive nature of running, and if you don't have biomechanics really dialed in, that's when things go awry.
Yeah.
And it takes a lot of strength to be able to do that properly. And most runners, I find, they don't either have the strength, the range of motion, or the motor control to be able to really execute just something as simple as a single leg squat, really with good mechanics.
Dude, yeah, I mean, it's hard.
Yeah, it's super hard.
Yeah.
But it's like nice to have those objective things to work towards and show our athletes, because that's what's going to be like make the difference in the longevity of their running careers.
So. Yeah. And so, oh man, I mean, I remember Matt saying that to me. He's like, Hill, you have to be able to, perfect a single leg squat before, you can do this. And of course, everyone of them looks different. Like one of the recurring injuries that I had was ankles. And so my dorsiflexion on one side is like pretty limited compared to the other. I mean, it's getting better, I hope, but that would limit my range of motion for like a proper squat. So for me, it's like even more important that my hips are super strong to be able to withstand that. And so this is like a good segue into kind of like, what are these like common ailments or like specific things that you see with runners? I feel like it's a myth that they're like, oh, running's bad for your knees. It's just like, I don't think so. I think it's just like, well, let's like work on your hips, dude.
Bad mechanics are bad for your knees.
And the Revo stance, I'm always like, Revo butt. You gotta have like strong butt.
Revo butt. We're gonna trademark it.
Okay.
I think so. Big things like the crux of what we do as a PTs for runners is like bone stress injuries and any like tendinitis stuff. If you're gonna be a good PT for runners, you have to be really good at managing those. So I'd say right now my caseload of my runners, I have probably 50% are bone stress injuries or bone stress reactions. And
from like blunt force trauma or no?
No. Okay. So like think like a stress fracture.
Okay. Got it.
Repetitive stresses to the bone over time. And there's a lot of, they can be really tough to treat because there's so much going on that go into how those develop.
I was about to say, because like, I think there's a common misperception that stress fractures are due to the pounding nature of running.
No.
And
like that certainly can contribute, but I go back to like biomechanics. I go back to like even like bigger picture stuff. Like what does their recovery routine look like?
Yeah.
Are they fueling properly?
See, a lot of the athletes that I work with, like for like if that happens, it's usually a combination of such. It's like biomechanics are out and they're probably not eating enough because bone strength is nutrition is so pivotal and so important in that. And then also like with your bones, like they're so cool. I used to teach anatomy and physiology and it's so cool to see like you in a bone, it's not just like this like pure white like it's a living organism and like it creates
just layers upon layers
based on your stress patterns and your gait. Certain areas of the bone will actually become more calcified and become stronger. And so if you think about that, if you have kind of a gait that's off,
and it's like Wolf's Law. Your bones will adapt to the stresses that are applied upon them. But that kind of, there's a threshold for that too. So, and that's where people, a lot of like kind of toe that line. And that's when bone stress injuries occur. So I'd say that's a big chunk of my caseload pretty regularly with runners, especially adolescent runners, just because there's a lot going on there. But I've had a couple masters runners as well. So I also look at age has a big role in that too. What is happening at the hormonal and metabolic levels too that could be contributing to that. So I almost always, when I'm treating a bone stress injury, if it's an adolescent, I'm talking to their parents, I'm getting them really involved. I usually refer out to a registered dietitian. I just find that they're a wealth of resource and a wonderful resource and just a wealth of knowledge because I know my limitations. And usually there is a fueling like a mishap there. There's something going on in two different areas in the body, depending on where the stress fractures is, can be really indicative of is it like an under fueling problem there too.
Where really?
So usually like a sacral or like pelvic stress fracture, a lot of times that can clue you into certain mineral deficiencies. So the body's actually pulling minerals from the bones in that area, kind of the more core areas. And then like lower extremity, kind of your typical like a tibial stress fracture, that tells me a little bit more like biomechanics. That's kind of what I'm thinking. I'm not thinking right away potentially like a fueling issue. I'm thinking more biomechanics, but certainly that fueling can also contribute.
What about a femoral stress fracture or like something like that?
That could go either way too. Yeah. So I would look a ton into biomechanics for that too.
Yeah.
But I think anything closer to your axial skeleton, meaning like your low back, your spine, I almost kind of jump to maybe a little bit more potential for that underfueling or a mineral or a vitamin deficiency.
Wow. So. Yeah. See, and then, so how does, because I go straight to like, so my mom actually, she has osteopenia, so not osteoporosis, but like
the precursor.
And this was actually because she spent time in the Peace Corps in Nepal, and her diet was like, she wasn't getting enough nutrients that she needed. And actually, she didn't have a menstrual cycle for like 2 years.
That's so common.
And that was in your early 20s. And so maybe this is TMI, but I don't really care. I'm an athlete. It's fine. I talk about my period to my coach all the time.
I think that's healthy. I think that's a good thing.
And he's a man,
that has a huge role in role in how you perform as an athlete too.
Yeah. So. And so like me as a developing teenager, like I was so active that my menstrual cycle was never the same. Yeah. Like I would go from with 3 months and maybe then I'd have a period and then maybe not 6 months. And actually during my injury recovery, because my bones were healing so much, I actually did not have a menstrual cycle for nearly a year. Yeah. And I was kind of I know that this stuff is important. And so I know it's one ways to combat that obviously is making sure you're eating enough, but strength training. Totally. And that was something that was super pivotal for me to kind of get my body reset. Yep. And maybe I think it just signals different hormones to recruit to your skeletal system to
exactly like all your muscles attached to bones, right? So you need to pull on those bones to make them stronger. Yep. And how do we pull on those bones? It's going to be resistance training. Exactly. So that's another, there's just so many reasons, but bone health is a huge reason why resistance training is so pivotal for strength, for runners.
And so then I guess kind of along the same line, you mentioned tendinitis,
soft tissue stuff.
Yeah. So that can could overstrength training lead to tendinitis? Maybe not.
I wouldn't jump to that, but I think again, I go back to biomechanics. I know I sound like a broken record right now, but I like to see how are runners running to really know what tissues are they loading. Are they overloading? A lot of times people are overloading their calf complex and not using their hips enough. Oh no, that's me. Especially for people running lots of elevation. Are you using your glutes enough? Things like that. Yeah. So when I see an Achilles tendinitis patient or tendinopathy or tendinosis, whatever you want to call it, I'm looking at glute strength a ton. Are you trying to propel yourself with your calves versus your glutes on those uphills, things like that?
Yeah. And see, actually, I think that's interesting. Like a runnable uphill, maybe it's easier, you get into the calf kind of thing, the little, but I think I love the steep train. And so I can feel myself when I'm power hiking that it's more of the quads and the glutes.
Yeah. And it should be. Yeah. It really should be. The calves get enough work as it is. They don't need more. Yeah. So that's where the glutes come in. They're the biggest muscle in the body and you should be really using them. So, and that's how you're going to propel your center of mass. They're closest to the center of mass. So think about to just a mechanical advantage. You really want to use them to push off. So.
And I'm a big fan of the posterior chain strengthening.
Yes.
Yeah, but why is that? I mean,
it's all in the hips.
Yeah. I think that's what Matt says to me every single time I go into Revo. It's Hill, more butt. I'm like, oh my gosh. Hinge. The hip hinge.
I know, I go to bed at night and I just hear hinge in the back of my head.
Oh my gosh. So yeah, so please, if that's one takeaway that people get from this.
Everybody hinge.
Exactly. Hip hinge. And come into Revo to actually find out what that is because it's actually really important for the form. But yeah, so I mean, is there any other stuff you can tell us about specific PT for runners or how you treat people when they come in? I think that's another huge thing is there is and I hope to have another podcast on this too about the topic of buy-in. But totally. There's a lot of to get, I think a lot for runners, to get to the PT, things have to be pretty bad. Yeah. Because I was hit rock bottom, it was easier for me to come back and commit. Yeah. But I feel that first step. And so when you're talking to someone, how do you get them to kind of buy into it?
I think if someone is skeptical and let's say they're not injured, I just go right back to that performance piece. This is how you can make some serious gains if you're not strength training initially. When it comes to just PT in general, I can spot, I don't think I've ever seen a perfect running pattern. Like, I think there is something almost everyone can improve. That being said, I try not to change a whole lot. So, talking about like things like foot strike, it's so hotly debated in the PT world and the running world, and it's really inconclusive on like what's best. There's pros and cons to every type of foot strike, right?
So like heel versus
exactly,
like toe versus like midfoot.
Yeah, exactly. And I think I always look proximally, so I look more towards like what's the trunk doing, what's the hips doing, things like that, and I find that can clean up a lot of, if we're having issues downstream, that can clean up a lot of things. So even if someone's not symptomatic, like I want to watch them run and try to convince them like there's still some things you could probably work on, like let's get your glutes going a little bit more. Like that's like the number one thing I see is people don't use their glutes enough. Everyone runs really upright. So when you're in this like upright position, it's a lot harder to engage those glutes. So if you can feel just forward trunk lean, you're gonna have a better cadence. You're gonna have a better foot strike. You're gonna be able to absorb a lot more through the hips, and then use those hips to propel yourself. So it's kind of all interrelated.
Yeah, and runners, at least hill runners can definitely visualize that, I think, a lot more. I mean, I say this to some of my athletes, like when we're doing hill repeats, especially like VO2 max style ones, where it's like 10 by 1 minute
all
uphills.
Out,
Oh my God, they suck. But a way to kind of like feel like you're going faster, and actually I think does it. Two things actually. Lean forward into the hill and like swing your arms. Like I feel like that helps you kind of like get into it. You feel like not that you're gonna like fall over, but like you're leaning into the hill.
It feels really exaggerated when you first start working on it, but it makes such a big difference.
Yeah, absolutely.
And I think going back to your point of like why is it important for me to lift upper body? Like think about that, like that contralateral like propulsion that you need to really get those arms going. And like fatigue resistance for those muscles too. Like you don't want your arms to like kind of bonk out before your legs, right? Like you really need those arms in those moments when you're really pushing uphill. So that's another piece of the puzzle. So.
And so in ultra running, like it's kind of more style like in Europe, like when there's super steep and really long climbs, people use like trekking poles. And so in long distance ultra running, that's a huge thing. And again, it's like, I mean, there's certain times like you can feel it. I mean, you don't want your arms to get sore.
Exactly. So you want to like be able to maintain that, right?
Yeah, and it's actually a good way for you to like boost your VO2 max because you're like using your whole body.
Exactly, right? More bang for your buck.
Yeah, and triceps, those look good on everyone.
Check.
That's awesome. But obviously there's the performance thing that you can talk about for like a buy-in. But I mean, also for me, it's like, how do you keep a runner strength training even after they're injured? Because I feel like that's also typical. It's like most runners are like, oh, well, I'm better. Like I'm going to go running. And it's something that happened to me too. It's like, oh, well, like I just want to run now. So like
I don't need XYZ.
Or I don't have time for the gym. But like maybe it was just the nature of my injuries that kept me a little bit more, attached to Revo.
I think you're kind of an exception, but I think obviously falling off a cliff leading to those injuries is one thing. But most people, their injuries are multifactorial. So there's other things that lead up to it. And I don't find that those are just resolved right away. So we can get someone asymptomatic. I sure as hell want to get them. I want to get them through that prevention piece too. But that's where a lot of people kind of falter, and I think that is something I'm working on as a clinician too. Is like selling that, for you to continue running at the rate that you do for the next decade, you need to be doing XYZ, and that's something I think. Runners are very headstrong, and that's why they're good at running. But I think that is something that they need to take ownership of, and then I need to really educate them on why this is important. So that's something I try really hard to do in all my positions, but especially when I'm treating endurance athletes, because it just doesn't just go away when you've had one issue. And I think most of the people I see, like they start to realize that as we're working together and developing that like therapeutic alliance. they learn to trust me as a clinician, and then knowing that like there's other things that are contributing to this. It's not just this like one ankle sprain, or it's not just this like lateral knee pain that I have. There's other bigger picture things that we can address.
Yeah. And so, I mean, I think I don't want to like, just like give, people like, okay, like do these things and like this will help.
Kind of a
but
blanket,
but I mean, I think like you said, like every person is different. And I think it's important to kind of see where your biomechanics lie. And even if you are injured, or certainly if you're injured, but even if you're not, to kind of see that preventative stuff. But like for me, some staples that have been in my strength training plan have been, squats or deadlifts. And, that can be amended based on, like for me, my range of motion in my ankles and things like this. Like,
absolutely.
Types of deadlifts. Like for me, it's like trap bar versus like a straight Romanian deadlift. I feel like I'm a gym rat now, like putting all these things.
Throwing all those terms.
But yeah, you guys can look these up. It's just like trap bar deadlifts are really cool. It makes you like feel very strong. But yeah, and so something for me that's always like that I'm always like fighting against is how tight my calves can be. Because that can cause different issues. For me, not only in my range of motion in my ankles, but I feel like strength training and PT, it's like, it's definitely the actual act of lifting heavy weights or some sort of weight or working on that imbalance if you have it. I think most people do have it, have some sort of imbalance.
And that's normal.
But exactly. And I think it's also just the recovery aspect too. Like, I use Revo just as much as coming like to lift weights as I do to do recovery and, stretch and do little like ankle mobility things and, dry needling.
Absolutely. I think runners really just like to run, but that and like we talked a lot about strength training, but the recovery piece is equally as important. And that's where PTs come in quite a bit. So you mentioned like dry needling.
Let's talk about that for a second. What is dry needling?
Dry needling is the use of an acupuncture needle into like a quote unquote dysfunctional muscle. There's a couple different like indications for you. We're needling your calves because they're super tight. The insertion of that needle causes changes at the chemical level to help that muscle release. We can use it at like certain trigger points. So say you have like a knot in your muscle. Putting a needle in that area can help release that muscle tissue. If you think about you have a big knot, that's muscle tissue that's banded up. Muscles need to shorten to contract. If you have this banded bunch of tissue, that's tissue that's not contracting properly. So it's not doing its job essentially. So for you, like when I needled you on Friday, like you had a couple really big muscle knots in there. That's contractile tissue that's not able to contract because it's over-shortened. So that's where dry needling can come in as well. It's an awesome tool for both like from a therapeutic standpoint, but also from like a recovery standpoint for more performance athletes. And then things like foam rolling and ankle mobilizations and lacrosse ball to those like trigger points, those tender spots. It's all really another important piece of the puzzle. So that's another thing I'm harping on a lot of my patients about.
Stretching for runners.
I know.
Yeah, because like I know some just don't at all. And like, and I mean, I would say that I think it is beneficial to some
Totally, yeah.
Like I know endurance athletes, they don't need to be as flexible because like there is some benefit of having a little bit more like kind of less, like more muscle tension.
Yeah, exactly.
As opposed to like maybe a sprinter, like a fast 5K, 1500 meter runner. Like they need like full muscle like extension and contraction.
Full range of motion. Yeah.
So
I think I believe that stretching, it wasn't something that I stressed as much until I started working here with a lot of higher level athletes. And I don't know if I have a good answer for why, but one of the big things we stress here is 2 to 2.5 minutes for every muscle group. So if you're going to be stretching and you're doing anything less than that, like 2 to 2.5 minutes, you're kind of wasting your time. That's what research shows you need to do to actually make a clinically significant difference in the length of the tissue. So longer holds, I make people just set a timer because it feels like forever, because it is forever.
Yeah.
Like 2.5 minutes feels so long when you're actually doing it.
Yeah.
But that's what you need to do. Yes, I know. I know. So I think one of the biggest like say faults I see with running is lack of hip extension. So a lot of times that could be, is that a glute strength issue, glute max strength issue, is that hip flexion tightness. So kind of deciphering that. And I have a lot of people just do a long like hip flexor quad stretch hold to address that. But that's another thing that we pick up on quite a bit, is that's a big piece of the puzzle as well.
Yeah, and I think actually, so Revo has, and I was using this when I was traveling a lot, like for races. I mean, obviously, like Matt, he would write me a strength program. So if I didn't have like access to a gym, I still had things that I could do. It doesn't necessarily always have to be super heavy if I didn't have access to a gym. But on their website, they have like a YouTube channel, and you guys post a lot of good things, and also on Instagram, it's Revo Sports and Performance. That's I think the hashtag Revo. Revo Sports and Performance. REVO. And you guys post a lot of good information there for like either just like little videos.
Yeah, we're always working on content. I think I actually have to look up our hash or what our tag is. Yes. Revo, let's see, Revo PT and Performance.
There we go.
I should know that.
Yeah, me too. I know, I'm tagging them all the time. Revo PT and Performance. There we go. But yeah, so I mean, if there's anything you want to add, we've covered a heck of a lot. But
yeah, I mean, like strength training for runners is a beast of a topic. We can go down a lot of rabbit holes here. Yeah. I think
a basic routine. Do you think that that's something besides, I obviously would encourage people to come in and get their
like
specifics.
A full assessment. Yeah, exactly. Yeah, absolutely. I think if someone is asymptomatic, any listeners that are just looking to add something into their routine, like 1 to 2 times a week, I can promise you'll see a difference. I think like a heavy front squat, heavy like squat at all with a barbell, trap bar deadlift, hip thrust. I would like add in like a heavy lower body movement with a barbell. I would do like a single leg strength circuit. So let's say like single leg RDLs, single leg squat, single leg calf raise, and then I'd finish it off with like some hip and core accessory work. So like side plank variations, fire hydrants, skaters, side steps, like all that. And that's kind of how I'd format. That's how I format it quite a bit for my runners that are kind of working into a strength program. One other thing I really like to emphasize for runners who are getting into a program but are kind of higher level runners, like running quite a bit of mileage per week, make your hard days really hard. So, and I know you know this. Yeah. You want to make sure your rest days are true rest days. So on the days that you have a hard track workout or a hard hill workout or whatever it may be, that's the day I'd want them in the gym doing some strength training as well. Make that day all out. That way your rest days are rest days. Yeah. So you know that better than anybody. Oh
man, yeah, those days become like an 8 p.m. bedtime.
Yes.
Of 9.
No shame.
And and then you eat a lot of food too. But no, that's something my coach that he would come here to Revo as well. He's since moved. Yeah. But he's always harped on that for me. And that's something I harp on for my athletes as well. So it's like, make your hard days hard.
Yeah.
And definitely, I think it's worth it. Even if it feels like you need to get that extra motivation.
Yeah.
But so I think my final question for you would be, if you had one piece of advice for runners and strength training, what would it be?
Oh gosh.
At least my piece, I'll help you out here, because my piece would be like, don't wait for it till it's too late, right? Yeah. Like for me, I thought I was relying on my kind of strong muscular frame.
Yeah.
But, and that's something that saved my life during the accident. But again, Revo and discovering these guys and discovering an awesome place to like do strength training is something that, I wish I would have found sooner.
We're really fortunate. Yeah. Revo is a special place, and I wish everyone had access to something like this. But, let's see, if I were to say one thing, like if I'm having a really hard time convincing someone they need to strength train.
Yeah.
I think of, so this is kind of off the wall, but there's this strength coach. His name's Mark Ripito.
Okay.
And think like he's like at 80s power lifter. Think like Arnold Schwarzenegger-esque. And he has this awesome quote, and it's stronger people are harder to kill and more useful in general. And that's like what I come to every time. I'm like, if like you can't like look at the performance piece or the injury prevention piece, like you're going to be harder to kill if you can run or if you can strength train.
Oh my gosh.
So that's what I come back to.
I need a quote that says this.
We're going to like put that like on a bumper sticker or something.
Oh my God, that's amazing. I love it.
That's what I come back to. So,
all right, guys. Yeah, come on, runners. Like, let's not
are you
be
sold yet?
Yeah, I think so. I think especially like, you know, if you're not runner bird arms, like if anything else, it's like, you know, like let's
be
stop
harder to kill.
Exactly, and let's stop those jokes. You can run for far ways, but yeah.
Yes. I know. I feel like a little weird saying that in front of someone that fell off a 100-foot cliff.
You know what though? But it applies true.
Yes.
Harder to kill. Oh man.
So I'll leave everyone with that.
Yeah. Well, on that note, thanks so much for joining us
Thank you
today.
so much, Hilary.
It was awesome.
Thank you.